It's part of something much bigger than themselves.
The spelling of your name here, address, and also the date of birth.
They are here to help doctors in a dramatic effort to find a long-term treatment, perhaps even a cure for a disease that affects people of every race, in every culture, and in every country around the world. Worldwide, an estimated 5 million people suffer with sickle cell disease. In Mediterranean countries, large numbers of Arabs and whites are affected, while in the United States, sickle cell primarily affects African Americans. 1 in 500 has the disease. That's 80,000 Americans desperately looking for a chance to live a normal life. Another 2 million African Americans have the sickle cell trait. They are not sick because they carry only one copy of the defective gene that causes the disease. If 2 people, each with sickle cell trait, have children, there is a 25% chance that one of their children will have sickle cell disease. Doctors discovered that Infinity Duncan had sickle cell disease a few hours after she was born. The problem showed up in a blood test routinely given to most newborns in this country.
It was a surprise because when I had her, I was 17. I wasn't really that knowledgeable about, I knew about sickle cell, but not in depth to the point that I thought it could actually happen to me or my child.
Sickle cell disease is a genetic disorder that interferes with the production of normal red blood cells in the victim's bone marrow. These red blood cells, which provide life-giving oxygen to organs and tissues, begin to change shape. Normally, red blood cells are soft and round so they can easily squeeze through tiny blood vessels. But in people with sickle cell disease, the red blood cells become stiff and pointed, clogging blood vessels. When this happens, vital supplies of oxygen are cut off, permanently damaging nearby tissues and causing intense, debilitating pain. This is known as a sickle cell pain crisis. They strike children and adults.
It feels more so like if someone was stabbing me with a knife and over and it just doesn't stop, really sharp pains.
T-Boz Watkins may be a superstar rock singer, but she is also a typical sickle cell patient. When she goes into sickle cell crisis, everything else in her world stops.
I've had really bad ones, legs hurt, can't walk, arms hurt, can't use them, can't feed yourself, can't help yourself to the bathroom, can't wash yourself up, so you're totally like handicapped.
Almost anything can trigger a sickle cell crisis. Stress, fatigue, becoming too hot or too cold, a change of seasons, or common infections such as the flu. Growing up, a doctor told Tion Watkins what she might expect would send her into crisis.
It could be 110 degrees outside in the summertime, but when I go into a cold swimming pool, I go into a crisis. He was right about when I catch a cold, I go into a crisis. He was right when somebody punches me, I go into a crisis. I take precaution, like when people have colds, I have to wear masks sometimes. Like some people might get offended, but that's how I live my life. I have to do stuff like that, so I won't get sick, It's not normal in someone else's house, but it's normal in mine.
Sickle cell disease affects every organ and tissue in the body.
Dr. Lakshmanan Krishnamurti at the University of Minnesota is one of the country's foremost experts on sickle cell disease.
The first organ to be affected is the spleen, then affects various parts of the brain, so you can get a stroke, and eventually affects the liver and kidney.
For the past 5 years, Dr. Krishnamurti and his colleagues have been searching for a cure. Infinity Duncan is one of his patients.
Last year, she was admitted with an episode of fever, and then we noticed that she wasn't moving her left leg, and became obvious that she had essentially had a stroke on the left side of her body.
Let's see, I got to inject contrast in 5 minutes.
And they did the MRI and told me she had a stroke, and I didn't know how serious it was. I thought I was going to lose her, and I was just completely a step from a nervous breakdown.
Just like, there's just a lot of fluid buildup right around this area.
She lost movement in her left leg for a few weeks, but because she was so young, her body was able to have a recovery. It's not a full recovery, but to the eyes of people that aren't medically knowledgeable on that, it looks like a full recovery.
But look at this magnetic imaging scan of Infinity's brain. The dark regions show where the strokes have caused permanent damage.
Her vision is slightly affected. She wears glasses. She has a light prescription.
Infinity is not alone. Her doctors say everyone with this disease suffers lasting damage. Tion Watkins has never had a stroke, but sickle cell has affected her personal and professional life.
I found that, touring is very hard on me. It's easier if I do a day here, a couple days off. If I want to sing, then I have to take care of myself, or singing won't be here. So if I really want something in life, my health comes first.
One thing she and her husband, Damon, really wanted was a baby.
Before I decided to have my baby, we talked to my hematologist first, and, and he talked to a couple of people, and he thought that I could do it. I knew I could. I was like, I'm gonna make sure. But I felt in my heart I could. And I did successfully. She's so healthy, it's ridiculous.
For now, Tion is allowing no pictures of her 3-month-old baby girl, Chase. She wants some privacy. Chase carries the sickle cell trait, but is completely healthy.
Being that I have the disease, my daughter has the trait. She won't be sickly as I am, but if she were to get with a mate and have a child, her child could have the full-blown disease. So knowing that I'm aware, I can, wisen my daughter up and make sure her family will be okay.
Such homegrown advice was not available to Stephanie Duncan and her husband. It never occurred to them to get genetic counseling before they had Infinity.
Well, I knew I had the trait. And all I know about that is if you have the trait, you're anemic, and that's about it. So I didn't really have detailed information on it.
But Infinity's father, either he didn't know he had the trait or you all hadn't been tested?
We never talked about it, actually. So I think he knew, but it was kind of one of those miscommunication. Nobody ever brought it up, so it wasn't discussed.
You need to be aware of who you are and how your body works. Especially if you're gonna bring a child into this world. If you don't know yourself, you don't know what you can pass on to him or her.
Tion Watkins has learned to live with her disease. Stephanie and Infinity are just beginning.
I do everything in my power to ensure that she has a childhood. I want her to stay a child, but it has pushed her to kind of grow up a little faster.
You need some help or you got it?
I got it. It kind of makes her think about things that I don't think she should have to worry or think about, like her health. She shouldn't have to worry about her health at 4.
So Stephanie Duncan is trying to give Infinity back her childhood, trying to give her back her health.
Yeah, that's one of these two. You want to do it in your time?
That's why they are making this trip to Fairview Hospital. It is the first crucial step in a desperate fight against a disease that has proven difficult to treat and impossible to cure. Stephanie Duncan and her daughter Infinity battle sickle cell disease every day. They happen to live near Fairview Hospital in Minneapolis, one of only 15 hospitals across the country conducting advanced research into this genetic disease.
Genetic diseases do not have any quick fix. You can't make any environmental change, like you might make in, for instance, obesity or cigarette smoking. There is not one pill that you can take and be free of the illness.
I think one of the reasons why it's such a difficult disease is because it's really unpredictable course.
Dr. John Wagner is head of gene therapy at Fairview Hospital and part of the team treating Infinity.
Some patients who have the exact same mutation, the exact same disease, have really no problems whatsoever. And unfortunately, there's no easy way of predicting who are going to be the bad patients and who are going to be the good patients up front. You only know until after the fact. And so therefore, that makes it much more difficult to design a therapy that works for everyone when you don't know who needs it.
Science is not the only challenge when it comes to fighting sickle cell disease. There are social and political challenges as well.
Historically, though, there hasn't been, A, the interest, and B, the amount of money for this disease, right?
Well, that's true. I think that this has been improving over time. But you're right. There have been many other diseases which have been given higher profile and higher, amounts of funding made available.
The fact is, diseases like cystic fibrosis, which affect only half as many people as sickle cell, receive more than twice as much research money from the federal government. This disparity does not surprise the Surgeon General, Dr. David Satcher. He says sickle cell disease has never had many champions.
Some diseases, because of the people they affect and the lobby behind them, certainly have gotten more funding than others.
Dr. Krishnamurti, when you think about the disparity in funding and the disparity in scientific interest about sickle cell, do you think race plays a role?
I think race plays a role in everything. You know, I do think so. It plays a role for many reasons. On the one hand, civic activity, political activity, all of these depend on political influence. The funding also depends on how much clout people have.
We in this country have not yet developed a health system that meets the needs of all people, and our health system leaves too many gaps, wide gaps in terms of what's available to different people.
I really believe a lot of people don't get the information, and I think a lot of people don't care enough to do it either.
Despite these problems, a few dedicated researchers continue to study sickle cell disease. In 1998, doctors doing cancer research discovered almost by accident a powerful weapon they could use against this disease. It's called hydroxyurea. It is not a cure, but it has helped millions of sufferers by dramatically reducing the frequency and severity of their sickle cell pain crises. At the National Institutes of Health, Dr. Griffin Rogers was the first to discover how this drug might benefit sickle cell patients.
The patients generally will tell you that they feel better, their energy level was improved, and when you follow them in a more long-term basis, the number of crises that they're having is substantially less than what it was before they were on the drug.
Since the early 1950s, doctors have been struggling to find an effective treatment for sickle cell disease. There had been little progress until researchers discovered something very interesting about children who have inherited this condition. Most are pain-free for the first 6 months of life. But why?
They still have in their circulation something called fetal hemoglobin, which is the predominant hemoglobin that's made, as the name implied, during fetal life. In the second to third trimester of life, this fetal hemoglobin is produced. Now, generally the fetal hemoglobin gets turned off at about 6 or 9 months of life, and at that point the sickle hemoglobin becomes the dominant form. And this is why the kids or infants start having symptoms at that point. For me, the real question was, can one safely use a drug to reactivate fetal hemoglobin to treat patients with the severe varieties of sickle cell disease?
By the late 1980s, it was known that several drugs, primarily cancer drugs, could increase the level of fetal hemoglobin. The least toxic was hydroxyurea, a drug that had been used for more than 40 years to fight leukemia and other cancers. As part of a controlled experiment, Dr. Rogers began giving hydroxyurea to his sickle cell patients, and their fetal hemoglobin levels began to rise.
I guess that was a eureka point. This is what we thought might happen, and it's very gratifying that it did follow through in that regard. And in fact, over time, the drug has now become approved by the Food and Drug Administration for the treatment of these patients.
But not every sickle cell patient can take hydroxyurea. Side effects, including nausea and an increased risk of infection, make this drug difficult for some patients to tolerate. Doctors told T-Boz not to take it when she got pregnant because hydroxyurea can cause birth defects. And the drug is not yet recommended for children like Infinity Duncan because doctors worry about long-term risks. So when Infinity becomes sick with sickle cell, there is little that can be done.
It's very difficult to watch her get sick and lose her appetite or get a fever. That's really hard to deal with.
There is nothing about sickle cell disease that is easy. For the past 18 months, the only treatment for Infinity has been monthly transfusions and blood exchanges. Doctors hope to decrease the risk of stroke by diluting the number of sickled red blood cells in her body.
She understands it as sick blood. and that's how I explained the exchanges. Told her that we were coming in and they were going to take out some of the sick blood and put some healthy blood in.
But transfusions and blood exchanges over long periods of time carry serious risks. Iron from transfused blood can build up inside the body and become toxic. Doctors told Stephanie Duncan they could not transfuse Infinity forever.
Sometimes I would get upset, not with her, but just with the fact that she had to go through it, thinking of a billion other things she could be doing. And it started becoming frustrating. As much as I knew she needed it, I didn't want her to have to go through it.
Coping has been difficult for the entire family. Bonnie Davis, Infinity's grandmother, says there is no rest from this disease.
Even when I don't want to think about it, it's there. It has to be, because there's so much medical attention that you have to put on this disease, because there's just so many things that you have to look out for, you know. So every day I think about Infinity's, you know, sickle cell every day.
Coping became difficult for Infinity too. All of those trips to the hospital, the needles, the transfusions, the pain.
Things got to a point that she was becoming unhappy. She was unhappy. She was sad. She wanted to go play with other kids. She didn't want to keep coming to the hospital when she had a fever. She got tired of the whole hospital routine thing. She deserved a chance.
That chance is only days away. It will involve considerable risk. The procedure doctors planned for Infinity might complicate her disease, it might do nothing at all, or it just might provide a cure.
I look at her and she has so much strength and so much fight in her, and she wants more than anything to be able to go play and do everything that every other kid can do.
For Infinity Duncan, a chance for that normal life is about to begin. Doctors at Fairview Hospital in Minneapolis have determined that Infinity is a candidate for an experimental bone marrow transplant. They plan to replace her diseased bone marrow with new marrow, hoping it will produce normal red blood cells.
You already picked it out.
Hoping that it will cure her disease.
This can fundamentally rewrite how we treat sickle cell disease. And that's the most exciting and dramatic aspect of what we're doing here.
Bone marrow transplants have become almost commonplace treatment for people with some kinds of advanced leukemias and other cancers. But the transplant doctors plan for Infinity Duncan will be different from conventional transplants in two very significant ways. First, doctors will use lower doses of chemotherapy to destroy her diseased bone marrow. The higher doses given in traditional bone marrow transplants are too toxic for sickle cell patients.
If we're able to reduce the toxicity and prove that transplant works, we will be able to offer it, as we do now in this clinical trial, to patients for whom transplant was not an option.
The second difference concerns the bone marrow cells that will be used in the transplant. They will not be an exact genetic match. Because Infinity has no brothers or sisters, the cells will come from an unrelated donor.
Well, Infinity Duncan is actually somewhat unique in that she's going to be one of the first unrelated donor transplants performed for sickle cell disease. You know, as you can imagine, you know, most of the work that has been done with the great success with bone marrow transplantation has been done when using a brother or sister. However, we are going now into more of an unknown. Will this therapy, will this new approach to treating patients, will this work if you use an unrelated donor? We don't know the answer.
They told me, we'll give you time to think about it if you want to do this, and there was no thinking about it. You know, and I still ask myself if it was the right decision, but I don't see a change in my answer.
With the decision to go forward made, 4-year-old Infinity Duncan is about to become a medical pioneer.
Say right away, Ken.
When I help design a new study like this, it's all very easy at first, it's very objective. When you have this first patient who happens to be this adorable little girl, and you think about, am I doing the right thing? Have I thought it all through? Have I made a mistake? I mean, you really have the second guessing.
Preparation for the procedure will take 9 days. On this first day, a portion of Infinity's bone marrow will be removed, frozen, and stored. It will be reimplanted should the new marrow fail to grow.
As I was watching her go down the hall, I was just thinking of everything she was going to be going through, and I was looking at how she was healthy and fine before she came in, and I started thinking of how she was going to be getting sick, and I was trying to hold her hand, and I guess it's when they start speeding up and her hand kind of slipped away from mine. I kind of felt like I slipped away from her. It just really scared me, and I guess it's just a whole bunch of mixed feelings and emotions about what's happened and what's going to happen.
We hope that she will tolerate this well, and that we hope that she will be able to be cured of the disease.
Going in the back of the hip bone, we're just taking a few cc's at a time, about 5 cc's.
But I think it's only as the clinical trial moves along, we'll be able to know.
Day 2.
A little bit, okay?
Infinity begins receiving low-dose chemotherapy and small amounts of radiation to destroy her diseased bone marrow and prepare her body for the transplant.
We hope that she will be cured of the disease. We do not know that yet. And this is the best way anybody can ever know that it's the right, that's the way to go.
But doctors do know this experiment has risks. Infinity could develop seizures, infection, or a potentially fatal condition called graft versus host disease. That's where the transplanted cells actually attack and begin to destroy Infinity's own organs and tissues. To reduce the chances of graft versus host disease, doctors will use a new source of cells for the transplant. Infinity's diseased red blood cells will be replaced by healthy cells from the umbilical cord blood of a newborn baby, umbilical cord blood that is usually discarded after birth.
Umbilical cord blood has an immune